I'm a student physical therapist at Campbell University. Today I'll be showcasing how to perform the lumbar gapping manual therapy technique. Joint manipulations such as the lumbar gapping technique are indicated when normal joint play has been disrupted. The lumbar gapping technique helps restore normal joint play movements and is a high velocity, low amplitude thrust manipulation that is commonly used for the treatment of low back pain. According to research, there are 3 proposed mechanisms in which the lumbar gapping technique provides physiological change. The first of the 3 is the biomechanical model. This states that there is actually increased physiological joint space between the facet joints. However, the clinical significance of this is still not clear. The second of the 2 is the muscular reflexogenic model, which shows or states that there is a muscle contraction, possibly followed by a brief period of reduced muscle activity. And the third and final is the neurophysiological model, which states that there is a release of endogenous chemicals which provides an anti-nociceptive influence at the dorsal horn, which decreases the afferent nociceptive input to the brain. So upon our evaluation today, we found that you were having some difficulty bending over to the front, pick up your keys, and side bending to the side due to some pain that you were reporting. So we have a technique called a lumbar gapping technique that will actually help reduce the pain in your back and also kind of reset the mechanisms that are going on in the back. Is this something that you'd be interested in doing? Sure. All right. So before beginning this technique, you would want to ensure that the treatment table is at the mid-thigh of the therapist. Next, have your patient come towards you, towards the edge of the table as close as possible. Palpate the lumbar segments that you're trying to identify and utilizing a pivot motion, check for proper opening and closing of the segments. Once you've identified the section that you would like to mobilize, have the patient straighten their lower leg. Utilizing the top leg, you can have them lock this in under the lower leg. Utilizing the upper arm, pull the upper portion of the body up and into an extension, which helps lock out the segment from the top. Have the patient put their hand on their chest. You're utilizing your free arm, come in and lock in from the upper section. Now, utilizing your free arm on the lower section, find the area in between the greater trochanter and the iliac crest. Provide a mobilization force with the lower arm down towards the table, towards the therapist. The upper arm will provide a mobilizing force down towards the table in this direction. Sustain this for 10 seconds and ensure that the patient is okay and not in any pain or discomfort. Are you in any pain or discomfort? All right. So before completing the manual therapy or the technique, you would want to ensure that your patient is okay with you proceeding with the high velocity technique. Are you okay with us proceeding with this technique? So again, set up the position of the patient, have them come towards the edge of the table, utilize your pivot to check for opening and closing restriction, straighten the lower leg, lock the upper leg in under the lower leg, pull the upper arm into extension, lock in from the up top, find the slot in between the greater trochanter and iliac crest, provide the force down towards the table with the lower arm and down towards the table with the upper arm. Get them to in range and provide the mobilizing force.